Forensic radiology X-rays are helpful to the medical examiner in a variety of ways. Most commonly, X-rays are used to locate bullets in and around the body, its belongings. X-rays not only inform the medical examiner of the number and location of the bullet, but also how many bullet fragments are available for recovery. X-rays are particularly helpful if the tissues are sufficiently decomposed to obscure wounds or wound track. In the rare occasion, if a bullet embolus, an X-ray may prove invaluable in locating a wavered bullet. X-rays of all stab and incised wound will help detect a broken piece of a knife blade that may be retained in the tissues or bone. This is important because of the fragment of the knife blade may potentially be matched up with a suspect weapon. Identification of knife blade or blade fragment is also important for personal safety to prevent injury during manual exploration of a wound. An X-ray of the chest also provides a means of documenting an air embolus, a finding that may be difficult to detect during dissection. X-ray should be performed in all infant death and should include the entire body. The close attention should be directed to the extremities because these areas are not usually dissected, and X-ray finding may be the only clue of a healing fracture. Such a finding will then direct additional dissection. In this X-ray of a person with a gunshot wound of the head and not the radio opaque projected that's to be recovered 29.43. This one. Jacket to show up well on X-rays. One must be reminded that the small projectile component of such an aluminum jacket, plastic sleeve, or fiber fading from a shotgun charge will not normally show up on X-ray, must be identified directly at autopsy. X-ray on a gunshot wound victim should be carefully reviewed and interpreted because foreign objects such as stones on medical devices mimic bullet. In a gunshot wound victim, a radio opaque object thought to be a bullet was identified in the left upper chest. However, no bullet was recovered at autopsy. The object was revealed to be a metal hub from a needle thoracostomy catheter that was placed during resuscitation attempt 1929.44. Okay. The object catheter placed on X-ray for comparison. As was done in this case, X-rays should be first taken with all clothing and medical therapy left on the body and in a place in better to detect any projectile that may be resting on the body or in the clothing. The individual with a gunshot wound on the head sometimes despite a thorough search, certain bullets or projectile fragments simply cannot be found. When confronted with this dilemma, remember that radiopaque dental filling caps and artificial teeth can be confused with the projectiles or their fragment. In this case, in which the projectile could not be found, the teeth were re-examined and it is discovered that the right upper medial incisor was whiter, had a slightly different appearance than the rest of the teeth. Re-examination of the X-ray revealed that the tooth to be artificial and it had the characteristic post extending into the maxilla. The projectile was actually an implant. In a person with a multiple stab wound, the blade of the knife broken off during a stab wound of the back and become embedded in the back. Knife blade was demonstrated in X-rays of the chest of the victim, the subsequently demonstrated at autopsy. X-rays have proven useful and time conserving in the evaluation of vertebral artery injury. Post-mortem angiography using radio opaque contrast dye on demonstrative extravasation of dye from a tear in a vertebral artery. X-rays may be invaluable in helping positively identify an individual. Obtain X-rays to document findings such as air emboli that would be difficult to detect at autopsy. Use X-rays to locate bullet and determine how many projectiles need to be recovered. Use X-rays to locate retained places of a broken knife blade. Don't forget the angiography of the vertebral artery is a quick and efficient way to evaluate their integrity. Thank you.